Well, let's continue reading, and this part is about where do Americans get insurance. For the most part, the US has a third-party payer system, meaning health insurance plans, third parties reimburse doctors for the cost of services provided to patients. There are both public and private programs available to Americans. So the public system. Medicaid includes coverage by Medicaid, medical assistance, and Children's Health Insurance Plan, CHIP. Medicaid is a state-run program jointly financed by state and federal funds that serves lower-income U.S. residents. CHIP is similar to Medicaid in structure, but is specifically for children. And then Medicare includes coverage by Medicare and Medicare Advantage and is the largest federal healthcare program that serves almost 60 million elderly and disabled people in the U.S. And there are 4 parts to Medicare. There's a Part A, hospital, pays for your care in a hospital, skilled nursing facility, nursing home, as long as it's not just custodial care, hospice, and certain types of home health services. Part B is medical. It covers medically necessary services or supplies needed to diagnose and treat a medical condition. It also covers preventative services for illnesses such as the flu, including inpatient, outpatient physician services, and some limited outpatient prescription drugs. Part C, Medicare Advantage, also known as MA plans, and sold by private companies. MA plans come in 2 varieties. There's HMO and PPO plans, and they take place with a Medicare Part A and B, and often Part D coverage. Many offer extra, such as vision, dental, hearing aids, wellness services. Part D is prescription drugs, and it provides prescription drugs from a list called formulary, and each Medicare prescription drug plan has its own list. And most plans place drugs into different tiers, with each tier having a different cost. Other public insurance sources include coverage for military service members and coverage from the Veteran Administrations, the VA. In the private sector, employer-paid insurance includes coverage through a current or former employer or union. As a policyholder or dependent, in 1943, the IRS ruled that employees do not have to pay taxes on group health insurance premiums paid on their behalf by their corporate employers. This tax exclusion meant that the value of the healthcare benefit to the employee was greater than if the company offered the employee the same amount of cash, which would have been taxable. Thus, more and more employers began offering health insurance plan as part of an attractive compensation package for their employees. For individuals whose employers do not offer insurance or are self-employed, there is also the option to purchase private insurance. Non-group insurance includes coverage by policies purchased directly from a private insurance company. Approximately 49% of Americans get their health insurance through their employers, and as of 2019, and that's according to the healthcare nonprofit, the Kaiser Family Foundation. So maybe you have some additional thoughts around insurance?
Yes, there's another option that we have in the U.S., but though it's not considered insurance, traditional insurance, there's these health savings or these health sharing plans. So basically, provided you're in excellent health, they are hard to get to be a part of it. You have to go through a physical and screening, whether you'll be allowed to be on the panel. And you across the country with other families share health needs. So basically, every family has to put a certain amount of money in the pool based on their income. And then when there is a health need, you may receive a letter from another member at the advisement of the company that this particular family has a need, and this would be the amount that you pay towards their need. It's a really neat idea where corporately people are sharing and the burden of each other's needs. And I know quite a few people that are on that, and they really do appreciate it. So it's not just a check that's being cut for families, they may actually have another family that's reaching out, praying for their needs and telling them, hey, we sent our check and know that we're thinking of you. So it's a very unique program, though you do, in order to enroll in it, you have to be in great health and have no pre-existing conditions. But it is an option for some people.